Hello friends, welcome back to my YouTube channel. I'm Ashley Michelle. You may know me from a little show called 90 Day Fiance, and I've lost over 150 pounds and I'm an aspiring bodybuilder and fitness coach. Hello! Welcome to this video. This video is near and dear to my heart. If you have not seen on Instagram, which by the way, make sure you're following me, Ashley Michelle 90 Day. Guys, we're having surgery. We are doing a tummy tuck and a boob job in 50 something days, very soon. There were many reasons why I decided to do this surgery. I have lost so much weight and I feel like it's time, right? We've checked all of our boxes. For those of you that don't know the whole story, which I've talked about it on all my platforms, I'll link the podcast down below. My channel's here. You can sift through my content. I had gastric sleeve surgery in September of 2021. I have been weight training and weightlifting since before gastric sleeve surgery, consistently, and cutting since before gastric sleeve surgery. I got on a GLP on Mounjaro, oh my God, probably circa 2023, circa 2024, somewhere around there. I'm currently on retatrutide. I'm brand new on Retta, like 2 weeks. So I don't know much about it. We're testing it out right now, myself and my coach. And we're here. We're at 150-ish pounds down. I have really worked hard on making sure that I have a decent relationship with food. I don't think any relationship with food is perfect. And I think when you are dealing with somebody who is morbidly obese, I think the relationship with food gets really complex, and it's something that you have to work with all the time. And you don't even necessarily have to be morbidly obese to say that. You know what I mean? Food is something that we all have to deal with. Like if you have an addiction to alcohol or you have an addiction to a drug, you can just cut it out of your life and call it good. But food, you have to eat, you know? And it's also such a social thing too. No, I was not one of those girly pops who decided to get on a shot and just starve myself. I got on a shot and force fed myself and made sure I hit my macros. And if you want another video on my GLP-1 experience, let me know down below in the comments and we can really break that down and talk about it. I did ask Instagram for questions about GLP-1s and they gave me a bunch. So that video is going to be coming next because this is officially the first installment of Saying Farewell to my Fupa return. So if you've been with me for a while, you saw when we started Saying Farewell to my Fupa, I think we stopped around episode 4. So now we're back. The videos are going to be much more consistent because surgery is coming up. You're going to see everything, my workout routine, what I'm eating in a day, how I'm prepping, the things I'm buying for it, what the doctor is saying, what my BMI is, what recovery looks like, the whole shebang. Let's just go behind the veil, right? And really see what this is about. Today, I'm going in to see my doctor to finalize. What you guys are about to see is the initial appointment. This is the doctor that I went with. I vetted a lot of doctors in Rochester and outside of Rochester. I did decide to stay in my home city because I just wanted to be home. I didn't care about getting a couple $1,000 off to go out of country, let alone out of state. I wanted to be home. Those of you who don't know much about Rochester, we have really good healthcare. We have a good healthcare system here. We have a really good hospital system here. I just wanted to be home. I'm a homebody. Yeah. And there's a lot of great plastic surgeons here, obviously, including the one that I have. I'll link all his info below, Dr. Graham Plastic Surgery. You will get a discount if you do decide to do any work with him or come to Rochester to get some work done if you mention my name. And yeah, what else? You're going to see me talk to him. I asked all the questions that you guys had, so you don't have to. Everything from cigarette smoking to BMI, everything. I asked everything, scarring, everything under the sun. So take a look at this video, give it some likes, hype the video so other people can find it. Make sure you subscribe. I'm a baby YouTube channel. And my platform's slowly growing on here, but we want it to grow even more so I can keep pushing out content for you. And I hope you enjoy.
practice and some of the services we offer. I'll show you around. We'll be able to look at the surgery space, the operating room, the pre and post-operative area, and then we'll bring you in to meet with Dr. Graham to chat with him as well.
Okay.
Do you have any questions before we get started?
I'm really excited.
Awesome.
Let's just go for it.
All right this way. We'll look around through here. All right, so as we go down this hallway, we'll be returning back here to speak with Dr. Graham in just a few minutes. But in addition to surgery, obviously we do a lot of other aesthetic treatments here. A lot of injectables, Botox, Dysport, filler, skincare, medical grade skincare products, hydrofacials, chemical peels, laser skin treatments, laser hair removal, cool sculpting. So there's a lot of aesthetic treatments that we offer that complement obviously plastic surgery. So as we're walking through here, you'll hear different devices going and may see one of our nurses zooming through the hallways.
Can you tell me more about cool sculpting? I've heard of it, but I'm not really sure what it is.
So that is a non-invasive fat loss, and it's a device that freezes fat, areas of fat that are hard to, it's hard to target certain areas of fat when you're losing fat. So it's designed to freeze and kill those fat cells, and then they never come back. It's a permanent fat reduction or fat loss in very specific areas.
And how many treatments would you need to see results?
I always tell people expect to treat at least twice.
Oh, that's not bad.
Yeah. And it's not for like a weight loss, fat loss. It's more targeted pockets of fat in certain areas of the body. It's really effective when done correctly.
Oh, okay. Good to know.
Yeah, I've tried a few treatments myself.
Does it work? Yeah.
It absolutely works. Yeah.
Oh, that works.
Yeah, but just like any other device, some places use it better than others. So oftentimes when we hear patients say they didn't get the best result, we find that they've probably undertreated. Maybe not recommended enough treatments to give them a satisfactory end result. So you've got to be a good candidate for it and go to a place that knows how to use it.
Yeah. And how long have you all been in business here?
So we opened the surgery center 3 years ago. The practice opened 10 years ago.
Wow. Yeah. And you've been with Dr. Graham for how long?
Since day one.
Really? Wow.
Yeah. And so is our nurse Katie. You may see her. She's in the office doing treatments today as well. So on your surgery day, you check in the front just like you did today. One of our nurses will bring you back into this pre and post-operative area. Come right in. We'll have you set up in one of these beds, get you connected to an IV, a monitor. You'll meet the rest of the surgery team.
So this is where I would start and this is where I would recover?
Correct. Yep.
Okay.
So in this space, they're going to prepare you for surgery. You'll meet your anesthesiologist, the nurse that's taking care of you before and after surgery, the nurse you met in your consultation. She goes in the operating room with Dr. Graham. We'll probably also have his physician assistant with him, a scrub tech. So there's a whole team of surgical people that aren't here today that you'll be meeting that day as well. Yep.
All right.
So once everybody has introduced themselves, let you know who they are and what their role is, you'll review the surgical plan with Dr. Graham one more time. He'll do his markings, and then they'll bring you into the operating room.
All right. So it's all done here in-house?
Everything's done right here.
And for what I'm getting done, it would be same day, no overnight?
Correct. Yep. It's an outpatient procedure, so later on in the day, once Dr. Graham and the rest of the staff agree it's okay for you to go home, we'll be able to discharge you and you can recover the rest of the day in your own bed.
Amazing.
Yeah.
Okay. Yeah. All right. I love it. I love it.
So once you are prepared for surgery, I'll show you the actual OR. Like I said, this has been open for 3 years. Dr. Graham, of course, maintains surgical privileges at a couple other area hospitals, but this is the only place he operates.
Okay. We can't step past this line.
We don't go past this line, but you can get right over against that wall and see a little more of the OR.
That's where all the magic happens.
It is. That's exactly right. And that's about all you'll remember of it.
Right. Okay.
After surgery, you'll wake up right back at where you started in one of these recovery beds.
Okay.
At that time, whoever's with you that day, if it's you, will be able to bring you back into the recovery area and you can sit with her while she's waking up, while we're getting her some light refreshments, seeing how she's feeling, monitoring her vitals. We'll review post-op instructions with you. Our nurse goes over that. She goes over your medication dosage and frequency. And once you've been back here for a little while and are comfortable enough, we'll help you get up, go to the bathroom, help you get dressed. and then you'll be able to go home and rest the rest of the day. It'll be a pretty full day for you.
Yeah.
You're usually here about an hour before surgery starts and at least an hour after, too, given the amount of surgery that we'd be doing for you specifically. So it's a full day.
Okay.
You'll be sleeping most of the time, so
Yeah, which I love that. Love
everyone else will be hard at work.
Yeah. I love it. Super great.
Do you have any more questions about this space?
No questions here.
Okay.
No. So, what other surgeries do you do in-house besides tummy tucks, breast augmentations, anything else?
He does a lot of breast and body surgeries, so breast augmentations, reductions, breast lifts with augmentations, implant exchanges for people who have had theirs for a long time, want to make changes, anything like that. He does an amazing tummy tuck, so we do a lot of tummy tucks, body lifts after weight loss.
Yeah.
He does a fantastic rhinoplasty, eyelid surgery.
All of that.
All of that. Yep, and all of that takes place here.
Would you say the tummy tuck is what Dr. Graham is known for? Like, what's he known for?
He definitely does it better than most, for sure. He does an excellent one.
You guys hear that? Come to Rochester.
Yeah, he uses a different technique, and there's minimal scarring around the belly button, which is fantastic. So most of our patients, you can't really tell they've had a tummy tuck by looking at the belly button.
Yeah.
A lot of other surgeons have a technique where you see this kind of circular scar. It's really obvious that they've had that surgery, and Dr. Graham takes his time and does a slightly different technique to try and conceal that within the belly button itself. He can talk about that more specifically here in just a few minutes. But yeah, he does a really nice belly button.
Okay, fantastic. Yay.
Yeah.
I'm excited.
And then other surgeries we can do, without general anesthesia, we do in that hallway. But anything we just discussed is back here with an anesthesiologist always. Yeah.
So would you suggest, so after the tummy tuck, the boob job, all of that, I get down to go away at my maintenance phase, is cool sculpting something that people have taken advantage of after a surgery like this, or not really?
Probably not.
Okay.
Most of what we're going to be taking off of you is going to be skin.
Yeah.
There may be a couple little pockets that you could target with that, but it's more, in your case, I would say you're definitely more a surgical candidate than a cool sculpting candidate.
Okay, good to know.
We'll see afterward if there was something like that we needed to fine tune, but typically not.
And is that because of my extreme weight loss? I'm more of a surgical candidate than a cool sculpting?
Absolutely.
Okay.
Yeah, cool sculpting isn't going to do anything for your skin.
Right.
Yeah.
Okay.
Yeah.
Okay.
So, and if it were a small area, for sure, like sometimes that skin snaps back. But your skin, you've lost some of that elasticity. So in order to get the skin, the fat, any stretch marks off, really surgery is the best option for you.
Okay. Awesome. And the stretch marks. Yeah. Let's get rid of the stretch marks, man.
All right.
Awesome.
So we'll bring you in to speak with Dr. Graham next.
Welcome
How
back.
are you?
Doing great. Good to see you.
Good to see you too. This is my sister. She's helping me.
Nice to meet you.
Dr. Graham, Dave Graham, nice to meet you.
Nice to meet you.
Yeah, let's
What was
talk
your
about
name?
squats.
Cece.
Cece.
Yes.
Yeah. One thing that I loved about you was that you have a weight requirement, a BMI requirement.
Right.
There were other doctors that were like, oh, you've lost enough, let's get you on the table right now.
Right.
And so I'd love to highlight why you have that
Sure.
and the importance of that.
Okay. All right. So to address that last question right off the bat, there's a wealth of plastic surgery literature that studies relationships between BMI and complications after surgery, whether it's breast surgery, facial surgery, abdominal surgery, etc. And the magic number seems to be a body mass index of 30. Okay. So above a body mass index of 30, for whatever reason, the complication rates just seem to jump up.
Really?
So if you average out most of the literature out there, your complication rate with a BMI over 30 is over 50%.
Ooh.
So, I'm a plastic surgeon, but I'm still a physician. I don't want to make people sick.
Right.
So, if you have more chance of having a complication with a surgery as opposed to not having the surgery, then I need to wait. I need to make sure you're optimized. So safety is number one. Number two is actually the aesthetic result too. So, when your BMI is over 30, people don't realize you actually have intra-abdominal fat. So there's fat that actually coats your organs called omentum. Okay. And that fat gets kind of unpredictable over a BMI of 30. So if that fat is still hypertrophied, if it's still large, I can't give you a flat tummy, no matter how hard I try, because I'm working on the surface. So I'm trying to tighten a muscle. And if I'm trying to tighten a muscle and what's inside your abdomen is fighting me, I can never give you a flat tummy. So from an aesthetic expectation standpoint too, I want to make sure that I meet everybody's expectations. So number one is safety, and number two is aesthetics. So if you get your BMI below 30, I'm confident that I can give you a good result.
Right. Okay. Yeah. Very, very good to know. So between now and the surgery date in January, what do you think should be like my main goal?
I mean, optimize your weight.
Yeah.
I mean, the best you can, trying to get the best shape of your life, because the more loose tissue you have, the better shape you're in, that's the more I can take. The last thing you want to do is for me to do your surgery and then you lose another 10 or 15 pounds and then your tissue's loose again and you're disappointed, you know, because otherwise what's the point? Right. And also, like I said before, your complication rate is going to go way down when you're in better shape, you know. Right. And, you know, a low BMI comes part and parcel with, you know, probably your pulmonary function's better, your, you know, cardiovascular health is better. It's all interconnected. So, you know, as healthy as you can get before surgery, then you want to do that. And you're going to have smoother sailing afterwards.
Okay, okay. What's your take on smoking? Smoking cigarettes before surgery. So I know that different surgeons they say different things. Some say don't smoke for a year. Some say don't smoke for a month. Some say don't smoke for 6 months. What's your take on that?
So, I mean, ideally, don't smoke.
Right.
I mean, again, I'm a physician. If I can get you to quit smoking forever, that would be ideal.
Right.
You know, it's going to add years to your life. But, you know, the general rule is stop smoking a month before and stay off for at least a month after.
Okay.
And that includes patches, that includes vapes. A lot of people don't realize that. The whole point is the nicotine. So the nicotine causes vasoconstriction. And that's the last thing you want after surgery is your blood vessels to clamp down so you can't get oxygen and nutrients to this healing tissue. Because you're already going to need extra nutrients and extra oxygen just to heal. So you don't want to start off, you know, sort of behind the 8 ball.
Yeah, that makes total sense.
Yeah.
And so, big question, scarring. I know you probably get this a lot. I scar easily.
Right.
I saw a pamphlet up front on this, the Silogen. What are your thoughts? Like, should I just be lathering up in vitamin E oil every day? What are your thoughts on trying my best to prevent as much scarring as possible?
Right. So, you know, obviously doing what I do, I get this question a lot.
Right.
So I've done several literature reviews on it. The literature on vitamin E is kind of mixed.
Okay.
So you can find studies that say vitamin E helps, but you can also find studies that say it's harmful, you know.
Okay.
Mederma is kind of the same thing. The literature is mixed. The one thing that is consistently proven to decrease scarring across the medical literature is silicone. So either silicone gel or silicone strips, whatever is more convenient for your life. I always advocate for silicone. And I kind of feel like because I've got such diverse training and I've worked in burn centers, a testament to the effectiveness of silicone is the fact that they've been using silicone sheets, silicone dressings, things like that in burn centers for like 50 years.
Wow.
You know, so it's tried and true to help with scarring. The trick is you don't want to start it too early. So the silicone works by inhibiting the fibroblasts, which are the cells that make collagen.
You don't want them to get accustomed.
Well, you don't want to inhibit the fibroblasts too early.
Right.
So that's kind of the sweet spot. So I tell people to use silicone gel, and people are like, "Well, I'm going to use it 1 week after surgery." You got to kind of slow down because you need healing up to a certain point.
Okay, I see.
So I usually tell people they can start using silicone scar gel at about a month after surgery.
So don't even worry about it until a month after surgery.
Right, and that's kind of how I time my follow-up appointments too, is I always time a 1 month visit, and that's when, you know, I take out sutures, and that's also when I tell people they can swim, and when I tell people they've got the green light for the silicone scar gel.
Okay.
But that's tried and true. Now, let's say, for argument's sake, you start to keloid or something like that later on.
Yeah.
Then I'd start doing steroid injections.
Okay.
Yeah.
Okay, to help with
Yeah.
that.
Yeah. And there are some laser treatments that work, but you need kind of a pigmented scar. And I always like for scars to mature first. You know, scars really take a full year to mature.
Right.
So a lot of times it's just tincture of time.
Okay.
Yeah.
Okay. And I know we decided on 400 cc's for my boobies, so we're doing a lift and augmentation.
Correct.
Why 400?
So that's kind of a loaded question. So, you know, everybody's built a little different.
Right.
So I do a lot of measurements. I mean, I have a pretty in-depth consultation process. So I want to make sure, first of all, that it's the correct width for your chest. It needs to be the exact width of your chest.
And do I have a wide set chest?
Yeah, I think it is a little bit wide
Yeah,
because we
that's what I
pick
thought,
moderate plus for you. So
Yeah.
a moderate plus is a little bit of wider footprint of an implant.
Okay.
So it's got to fit your chest. It's sometimes it's dictated by kind of the distance from your sternal notch to your nipple or your nipple to your fold. There's several numbers that actually go into it. There's never a case where somebody walks in the room, I'm like, you're going to be 300. I have to do the measurements first. Now, when you're considering an OG lift, that's a little tricky because when you do the lift, you're actually pinching the skin together, so you're actually making the breast a little bit smaller. When you do the OG, obviously you're making it bigger, so you have to balance those two forces. So if somebody wants a lift and they say, well, I want 600 cc implants, I want a massive implant, I want as big as you can go, I can't do that because I have to make the breast smaller at the same time as I'm making it bigger. So if you put in too big of an implant when you're trying to do a lift, you're not going to be able to get it closed.
I see. Yeah.
So for that reason, even though I'm really thorough with my planning, I always have a backup implant. So we'll pick an implant that I think is reasonable considering we're doing a lift at the same time. But then I'll also have a backup size or two that just in case I'm in surgery and it's still too tight, I think that's just a safe way to do the surgeries.
Okay. And my next question is, I know when we had our consultation, you essentially said like I was a shoo-in. Why? What about my current routine, the whole thing makes me a really solid candidate for both these surgeries at the same time?
Well, I mean, you're in good shape.
Yeah.
I mean,
that's gonna help.
Yeah, you're in good shape. I can just feel on exam how good a shape you're in underneath all that tissue.
Yeah.
Just through experience, I know what's underneath there.
Right.
And I know once I remove that skin, and I pull it tight, just through experience, I know you're gonna get a good result.
Okay.
Yeah.
So anybody who is, they've lost a lot of weight or they're on this journey, what do you suggest to make sure that they're like a shoo-in? So what I'm getting at is this GLP-1 situation and people not weight training on it. So they're kind of losing muscle mass. I guess the question is, how important is having a solid, healthy amount of muscle mass before they undergo a surgery like this?
Right. I think muscle mass and protein kind of go hand in hand.
Yeah.
So, you want to maintain your muscle mass, you want to make sure you have enough protein reserves in your body, and you want to make sure, actually, preoperatively, I like my GLP-1, my massive weight loss patients, regardless of how you lose the weight,
Right.
I think you've got some underlying malnutrition to some degree, and that's been studied.
Yeah.
So I really want people to amp up their protein, at least 1.5 milligrams per kilogram per day before surgery. So yeah, I mean, the muscle mass per se, I mean, you don't have to be a bodybuilder to have a good result with this surgery, but you do have to be healthy.
Yeah.
So, I think the muscle mass goes part and parcel with just taking good care of yourself and having good nutrition leading up to surgery.
Yeah, that makes total sense.
Yeah.
I think my next thing is, can you tell us a little bit about yourself, Dr. Graham? Your history, how you got into plastic surgery, what your favorite surgery to do is, all that good stuff. Let the people know.
I mean, it's kind of a long story. So, I actually had some medical issues when I was a kid. I had a brain tumor when I was a kid.
Wow.
Yeah. So when I was 12, I had that removed, and that just kind of introduced me to medicine.
Yeah.
And I always thought, this is something I could do. I want to go into medicine. I want to be a doctor. I want to help people. Yeah. And I didn't really know what my my vocation would be. Like what field of medicine I would be fit for. But I was always just kind of a natural artist, painting, drawing, those types of things. Yeah. And then just randomly in like a high school anatomy class, I got introduced to plastic surgery. The teacher, I don't know how he got a hold of it, but he just showed us a little VHS tape on plastic surgery and medical missions and this type of thing. And I said, light bulb just went off. I was like, that's me. Like, I can do that. Yeah. This is what I'm good at. This is what I want to do. So I just went for it, and
and here you are.
And here we are.
And what is your favorite surgery to do?
I mean, I love these surgeries. I love like the full mommy makeover. Yeah. I love doing the breast. I love doing the body. Yeah. I like the surgery for the technicality of it, but I also love kind of, in a selfish way, I like to be kind of the last step in people's journey. People work really hard. They sacrifice a lot. And it's fun to have people walk in here. I'll have women walk in here wearing sweatpants, their hair's not done, you know, they just like, they almost half gave up.
Yeah.
And then I see them for their second or their third follow-up, and they're wearing this cute summer dress.
They're feeling themselves.
And I could see it in their eyes, and I'm like, that's it. You know, it's really fun. So I like that part. I like doing noses a lot.
Okay.
I know it's totally the opposite side of the spectrum, but it's just something I've got an interest in.
Okay.
And there's something about the mechanics of it and the artistry of working with the bone and the cartilage and this and that. So I like rhinoplasties a lot too,
Huh. It's crazy how, like, when people find their jive, because I could never, the blood and the crushing, I could never. I could see the light behind your eyes when you talk about it. Like, this is what you're supposed to be doing.
Yeah.
It's crazy.
Yeah.
My last question is, what can I expect on surgery day and after surgery day? I know we talked a little bit about the drains and stuff like that.
Yeah.
What's kind of to be expected?
So, you know, obviously day of surgery, you're going to get here probably about 6:45. You'll call the back. They'll let you into the building. And they'll show you in the back. They'll do all the routine things, start the IV, pregnancy test, those types of things. And then probably about a half hour later, I'll come in. I'll do some marking. This is a big surgery, so the marking itself is probably going to take 15, 20 minutes.
Okay.
And I always triple check, you know, my markings take a while because I want to make sure they're spot on.
Right.
So we'll mark you. And then, you know, you'll meet the staff. Angelia, you already know. You already know my nurse. You'll meet the anesthesiologist. We'll do just kind of some final things. If you're feeling anxious, we'll give you a little medicine through the IV, and then we'll take you back. I mean, surgery will take 5 or 6 hours. That's just, it takes what it takes. It's a lot of surgery.
Yeah.
After surgery, you'll be in recovery for an hour or two. You know, everybody metabolizes the anesthesia a little bit different.
Yeah.
But probably about an hour or two until you're comfortable, and then and then we'll you know, wheel you out, you know, to whoever's going to be taking care of you. I give everyone my cell phone number though, so if you have any issues that night, etc., you can text, you can call. It's really not a big deal. It's actually easier for me that way.
Yeah.
I'll call you the morning after surgery just to check in, see if you have any questions, make sure you're feeling good, and then I'll see you at 1 week, 1 month, and 3 months, and then sometimes I see you at a year.
Okay.
And obviously, if you need to be seen any time in between, then we squeeze you in. No problem. Yeah.
Okay.
Yeah.
I'm excited.
Yeah.
I'm going to ask the question that I know that everybody's thinking. Pain.
Right.
What's the pain look like? I know pain tolerance is relative.
It is.
But generally speaking, are people like down bad? Or, you know, when can I expect to be up and moving again? Obviously, I live a very active life.
Right.
You know, and it is a big surgery. It's my
Right.
whole frontal.
Right.
What's that kind of looking like?
So I want you walking right away.
Okay.
You know, the biggest concern with any surgery over a couple hours is blood clots in the legs that can go to your lungs. So I want you walking right away. So you'll be walking, you know, day of surgery.
Okay.
You know, you'll gradually progress in activity from there on out. I generally don't let people exercise for about a month after surgery, but like I said, you can walk that whole time.
Okay.
As far as pain goes, you know, I'd say when I call people the next day, average pain score is like 5 or 6 out of 10.
It's actually not bad considering.
Yeah, but it's all over the place. I'll call some people the next day and they act like nothing happened, and I call other people and they're like, it's 11 out of 10.
Yeah.
I will say I do everything I know about to prevent pain after surgery, so that includes giving you narcotics after surgery.
Yeah.
Generally, you only need those for the first 3 or 4 days.
Okay.
And then after that, a lot of people transition to,
Like
you know,
Tylenol.
or ibuprofen. I generally don't let people take ibuprofen or aspirin until their drain output starts to clear. It starts off a little bloody the first few days, but once it clears, then I feel like we're in the clear.
Yeah.
To add medications that could thin your blood, so you can supplement later. But I'll tell you one thing that I've started doing in the last year that I've really found effective is I use the Exparel. So Exparel is it's a liposomal bupivacaine is the generic term for it, but basically it's a long-acting local anesthetic that they complex to a fat, and by doing that they make it controlled release.
Okay.
So it's an injection that I do during surgery.
Okay.
I actually put it behind your muscle. So I'm actually getting the nerve fibers before they even get to the surface.
Wow.
So I inject it behind your muscle using a blunt cannula so I don't damage anything, and it lasts for 3 days.
Okay.
And that gets you through kind of that most acute period of
Yeah,
pain.
yeah.
And like I mentioned, I call everyone the next day after surgery, and it's been a game changer. I mean, I call everyone. Yeah, I'd say pain scores are down probably 3 points across the board since I started using that.
Okay.
And that's actually proven out through the literature too. There was a study out of the Cleveland Clinic I think it was not this past winter, but the winter before, where they compared what I was talking about, the experimental long-acting pain medication. They compared it to pain pumps. So you've probably heard of these on-cue pain pumps, which are great. But when they compared the pain scores, they actually found that the injection actually worked better, the 3-day local anesthetic.
Okay.
So yeah, I use that, and I'll never not use it now that I know how good it is.
Okay.
Yeah.
And then how much care am I going to need when I get home?
I mean, you'll need one person for the first few days.
And then I should be fine?
After that, you should be fine.
Okay.
Yeah, but definitely for the first few days.
Okay.
First 72 hours are always the worst, no matter what surgery you get.
Yeah.
Because that's just when your body's kind of amped up. That's when the inflammation's at its peak. Everything's extra sensitive, everything's extra swollen. And then after that first 3 days, things generally taper off. You know, I usually tell people with this surgery that the first 3-4 days is going to be post-surgical pain. From day 4 forward, it's going to be more pain from like the drains and the binder, more like annoying type pain from like peripheral things.
Okay.
Yeah.
Okay. And when do I see you again?
At 1 week. Yeah. But like I said, I call to check in the day after surgery, and then I see you at 1 week. And typically, depending on your drain output, we can pull out the drains.
Okay.
A lot of times I'll switch your binder, we'll switch your dressings out a little bit, and we'll just,
So at 1 week, that's when that's when the reveal will happen, when I will see my body.
Well, you'll see your body. So I let you shower at 48 hours.
Okay.
So you'll kind of get a glimpse.
Yeah.
But tape will be over the incisions. I'll have a little clear dressing over your belly button. So you'll see maybe 75% of it.
Okay.
But yeah, I mean, you'll get a really good idea at your 1 week visit.
Okay. All right. Very cool. And then, so from here on out, we're going to finalize my date right now. So when do I see you after this, but before surgery? Do you know what I mean?
Yes. So after you finalize the details, we'll give you an appointment probably 2-4 weeks before surgery for a pre-op visit.
Okay.
I'll repeat my physical exam.
Okay.
Because your body could have changed between now and then.
Which it will, because we're still losing.
Right.
My goal is just to cut as much as possible before this surgery.
Right.
So.
Right. So I'll re-examine you, and I just like to have that fresh exam too.
Yeah.
Because I like to have kind of your body in mind, and I can think about it before surgery. Also, it's a good chance to finalize the implant size. Yeah. Because, we want to make sure that we pick the right implant. You only want to pick it once. Yeah. And I'd say 10-15% of people change their mind at the pre-op visit. So it's definitely worth doing. Okay. So yeah, it's more to solidify the implant and to make sure that the surgical plan is clear in my mind.
Okay. Yeah. And then we go to it.
And then we'll get it done.
I love it. Amazing. Yeah. Thank you so much for your time,
Yeah,
Dr.
you're
Graham.
welcome. You're welcome.
I appreciate you.
Oh yeah. Yeah.
Okay, friends, that was the video. What do we think? Dr. Graham, huh? Super, super interesting. I think the more research I do on these surgeries, the more I realize I am going to be down for a while. I think some of my biggest fears that are like in my head are, am I going to get fat? To be fully honest with you, that's one of my bigger fears because I'm going to be so sedentary. And with my body type, if I'm not moving, the scale goes up. Like I need to be really active to cut weight. So that makes me nervous. Are my clients going to be okay? Those of you who don't know, I personal train in person and I fitness coach online. You can sign up to work with me while I'm gone while I'm in my bed because I'm going to have nothing but time. The application to work with me will be down below. Those are my biggest concerns, I think right now, just having to sit down, but we've been waiting so long for this. Babe, I've never had a flat stomach ever in my life. I've had big boobies before. That was really fun. But I've never had a flat stomach. So the idea that we're going to be getting rid of this is so exciting to me. I am nervous about scarring. I'm not going to lie. I'm going to do everything I can for that to not be a thing. But you saw what he said about scarring as far as scar tape and silicone and any of that. That is something to be looked at a month after surgery. So there's not really much of anything I can do right now. But yeah, we'll see. So Again, if you like the video, share it with somebody that you love. Make sure you like it, subscribe, comment below if you've had this surgery, if you know somebody who's had this surgery, what your thoughts are on it, what questions you might have, things you want to see covered in this series, Saying Farewell to My Fupa, so that I know, right? Closed mouth don't get fed, babe. Let me know down below, and I'll see you in the next one. Bye!